This is Zack, Gabe, and Randy's ADA project. The C.U.R.E Physical Therapy Clinic is located at 35 West Main Street in Annville, Pennsylvania. It is affiliated with the college's physical therapy program. It is a one-floor building which consists of several rooms. Pictured to the left on the PowerPoint slide is the back room, which consists of various examination tables. The picture on the right is the front room, which consists of the check-in area and a few treadmills. There are two entrances, one from the front and one from the back. The key about this area is it does pass the ADA standards for having stable and firm floors. And in the back room where the examination areas are, it passes the ADA standard for having carpet less than a ½ inch.
There is parking accessible in the front of the clinic along the main street and parking behind the clinic. There are few spots along the main street, but there are more available spaces around back. There is only one handicap accessible spot behind the clinic, which meets ADA standards of at least one handicap accessible spot per 25 parking spots. But it is hard to differentiate from other parking spots due to its faded paint and poorly placed handicap accessible sign, which would not pass ADA standards. Some solutions to these issues would be to repaint the handicap sign in the parking spot and to make the handicap parking sign located on the outer wall of the clinic more visible.
There is plenty of room in the back entrance of the PT clinic. This allows patients in wheelchairs or on crutches to easily maneuver themselves to the back entrance. In addition, there is a small lip at the base of the door frame. Although there is plenty of room in the back entrance, the steep decline of the driveway could cause some difficulty for patients in wheelchairs in controlling their speed. Furthermore, there is an uneven bump at the bottom of the driveway. Also, there is not much space for a patient in a wheelchair to utilize in order to get through the door. The fact that the front desk is at the front entrance can pose as an inconvenience to handicapped patients entering via the back entrance.
Here we see Zack crouching towards the back entrance. Notice the downward slope of the road and the uneven ground causing little problem. The front entrance is easily accessible unless the patient is wheelchair bound. There is a big step leading up to the front door which does not allow a patient or client to enter through the front safely. Due to this, the patient is required to go around the building to the back entrance in order to get into the clinic. An issue with this and ADA standards is that the front entrance does not have a sign saying where the additional accessible entrances are. These problems can be fixed by making a ramp for the front entrance or by putting a sign by the front entrance saying where additional accessible entrances are. Here we see Zack crouching towards the front entrance. Notice the big step at the front entrance. While this doesn't cause an issue for somebody on crutches, it could cause issues of accessibility for somebody in a wheelchair.
The alley between the C.U.R.E Physical Therapy Clinic and J&S Pizza could be looked at as an alternate route just in case a person may be bound by wheelchair, may have problems trying to enter the facility. This will not be able to pass ADA standards though, because there is no sign within the facility that says there is it serves as an alternate route.
This is the private examination room, and it meets all ADA standards. The frame of the door is wide enough for the entrance of a wheelchair, and the table's height is adjustable for patient-client needs.
The bathroom also meets all ADA standards. The frame of the door is wide enough for access via wheelchair, and there is enough space within the bathroom for the wheelchair to be moved around comfortably. The sink is of proper height, along with the soap dispensers and towel dispensers. And there are hand railings along the perimeter of the toilet for additional help.
This is a video that shows the accessibility of the bathroom. One key thing to notice here is that the door will lock in place upon being pushed to its farthest point. As mentioned before, there was a hallway that connects the front and the back halves of the facility. This is good because it gives you a nice convenient way to get from the front to the back. However, there could be some problems. There are varying narrownesses between the doors, and it could be a problem for some different types of people. And it also could be a problem if you have two people trying to get through there at once, because both of these people are not going to be able to fit through.
The hallway does pass ADA standards, but the varying widths, as you can tell, could cause issues. If you are bound by a wheelchair, it is unsafe to go out the front entrance due to the big step leading into the front entrance, which means it is necessary for a patient that parked out front to have to go around the clinic through the alley to get back to their car. If a patient exits through the back entrance and parked out back, it requires them to go up the steep slope, and if they do not have additional help, that could cause significant problems.
Here you can see Gabe exiting the practice in the wheelchair. Notice the difficulty that he has as he is trying to wheel his way up the steep slope. This can pose as a problem for patients bound by wheelchairs.